Headline: Coronavirus Presentation. PowerPoint presentations is supporting the facilitation of the exercise and its subsequent debriefing. A participant's guide and a facilitator's guide to explain what is expected from the different people involved in the preparation and running of the exercise. A set of reference documents and technical guidance on 2020 COVID-19. The package highlights clearly where some minor adaptations are needed to make the simulation country-specific and more relevant to the participants. If you need technical support to implement this exercise, please contact us.
What's COVID-19?
Coronavirus disease, COVID-19, is an infectious disease caused by a newly discovered coronavirus. Most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people, and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease, and cancer are more likely to develop serious illness. The COVID-19 virus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes, so it's important that you also practice respiratory etiquette, for example, by coughing into a flexed elbow. At this time, there are no specific vaccines or treatments for COVID-19. However, there are many ongoing clinical trials evaluating potential treatments. Who will continue to provide updated information as soon as clinical findings become available. For COVID-19 coronavirus, thermometer guns even work. That's essentially what those thermometer guns and other similar infrared body temperature measuring devices are trying to determine. You may have noticed increased use of such devices at airports and other checkpoints with the ongoing COVID-19 coronavirus outbreak. The purpose of these devices is to measure your body temperature from a bit of a distance. When sticking a thermometer in everyone's mouths or rear ends would be impractical, inappropriate, and potentially a bit disgusting. A healthy diet maintaining help boost your immune system, especially for more foods that contain vitamin C, may also give you an advantage. It is important to note that no research has been done on foods that specifically help in the fight against COVID-19. However, previous studies have found that eating certain foods can improve your health and boost your body's ability to fight other invasive viruses.
COVID-19. With simple measures, you can help protect yourself and others from infection with COVID-19, coronavirus, and detect signs of the lung disease early.
Keep distance. Protect the elderly by sufficient distance. Keep your distance when you stand in line. Keep your distance at meetings and events. Avoid unnecessary contacts and large crowds of people. Online video conversation can help. Wash hands thoroughly. Avoid touching other persons when greeting them, and wash your hands regularly and thoroughly for at least 20 seconds with soap and water. Avoid touching eyes, nose, and mouth. Avoid shake hands and contact. Avoid touching when greeting other people. Handshakes are a near universal business greeting, but in the era of COVID-19, we need to produce a more hygienic way of saying hello. Sneeze into the crook of your arm or into a tissue. Stay as far away as possible from others when coughing or sneezing, better yet face away from them. Sneeze into the crook of your arm or into a paper tissue that you then throw away immediately and wash your hand. Staying at home. Why staying at home is very important. It is very important that individuals with symptoms that may be due to coronavirus, COVID-19, and their household members stay at home. Staying at home will help control the spread of the virus to friends, the wider community, and particularly the most vulnerable. Those with symptoms and living alone should remain at home for 7 days after the onset of their symptoms. This will reduce the risk of you infecting others. If you live with others and you or one of them have symptoms that may be caused by coronavirus, COVID-19, then household members must stay at home and not leave your house for 14 days if possible. You should not go out even to buy food or other essentials, and any exercise should be taken within your home. The 14-day period starts from the day when the first person in your house became ill. If not possible, then you should do what you can to limit your social contact when you leave the house to get supplies. Staying at home for 14 days will greatly reduce the overall amount of infection the household could pass on to others in the community. Staying at home may be difficult and frustrating, but there are things that you can do to help make it easier. These include: plan and think about what you will need in order to be able to stay at home for the full 7 or 14 days. Talk to your employer, friends, and family to ask for their help to access the things you will need to make your stay at home a success. Think about and plan how you can get access to food and other supplies such as medications that you will need during this period. Ask friends or family to drop off anything you need or order supplies online, but make sure these are left outside your home for you to collect. Make sure that you stay connected with friends and family over the phone or through social media. Think about things you can do during your time at home. People who have successfully completed a period of staying at home have kept themselves busy with activities such as cooking, reading, online learning, and watching films. Many people find it helpful to plan out the full 14 days, such as on a makeshift calendar. You may also find it helpful to plan what you will do if, for example, someone in the household were to feel much worse, such as have difficulties breathing. When you are feeling better, remember that physical exercise can be good for your well-being. Look for online classes or courses that can help you take light exercise in your home.